Friends, we are meeting here for launching a Indian Stoma Care Nursing Education Program. This program is because there are increased incidence of cancer of the large intestine and bladder, and they end up with stoma, and there is lack of nurses in India for stoma care. Without trained nurses, it is difficult to take care of these patients. I will show you a presentation which takes care of this and explains everything. What is stoma? It is an artificial opening created by surgeons for diverting either stool or urine after removal of rectum, which is the lowest part of the large intestine, or bladder for cancer or birth defects. In the history, stoma has been recorded. Is ostomy life, which is after a stoma, the patient lives a life with a ostomy. That is why it is known as ostomy life. Is it a tough? Yes, it is. Ostomy can happen to anybody, anywhere in the world, any sex, any age. At one time, medical professionals focused only in removing the disease and not caring for rehabilitation. No thoughts as to how the patient was to live normal stoma life. Today, we cannot shake our responsibility by only treating the disease. We have to fully rehabilitate the patient as well because it is a serious handicap. In 2004 in Portugal, International Ostomy Association adopted a charter for ostomates that everybody should have a pre-operative and post-operative counseling, and everybody should be fully rehabilitated so that he can live a pre-operative normal life. For rehabilitation of ostomates, there are few things which are very important. One is trained nurses and doctors. Patients need counseling. Patient also needs somebody with a stoma to see before the operation, and product availability should be there as well. We have variation in standards in healthcare across India because it's a very big country. If you see in Italy, for example, in Europe, they have 50,000 ostomates, but they have 500 fully trained nurses and 2,000 nurses who are trained only in stoma care. If you see India, vast country, 100,000 ostomates, but we have practicing stoma care only 30 to 35 nurses after 30 years of a training school which was started in Tata Memorial Hospital. They have trained about 100 nurses, but today there are only 30 to 35 nurses practicing in India. So we have a very large number of nurses which needs to be trained for taking care of these ostomates. If you don't have a trained nurse, this is what can happen. They don't know, patient will not know how to wear a bag to collect the stool or urine. They can end up with a skin problem because they don't know how to use proper products and the accessories with it. Patients, those who are not exposed to any stoma care, can end up with using only cotton newspapers, and they continuously smell of either stool or urine. But if you fit in a proper appliance, then they can live a normal life. This is a patient who had a urostomy, is a farmer, and urine was continuously looking because he was not wearing a waterproof appliance. Only when we fitted it during a workshop, he was a happy man. A child can also happen. This is not very uncommon to see in just outside metro cities in India. For stoma nurse to work properly, to give a proper care, we need a stoma clinic, and stoma nurse will work in the stoma clinic to see patients, do pre-operative counseling, can call surgeons if required. We can, in stoma clinic, we can educate nurses, we can educate patients, and we can actually show to the patients how to put in appliance properly. Children also can suffer, and this is in just outside city of Bombay, where both the children which are shown are young. They don't have any stomach care nurse available locally. They don't know what appliance to put in. They were continuously smelling urine and stool, and that's why they never went to school. Then they never had any friends. They never went out to play with somebody, and therefore they ended up recluse and uneducated. You can prevent complications like this if you have a stoma clinic and you can follow up the patients. International Ostomy Association is an organization of patients who have stoma, and they promote and help nations to form stoma association and develop a stoma care program. These are the countries which we represent. Currently, I am an international ostomy president. The Lions played a big role in stoma care in Asia and other developing countries. It was first started, what is known as Lions for Stoma Care project was first started by Professor Carlo Pescola in Italy in 1999, and he worked extensively in Asia. I was part of the teaching team with him. Lions for Stoma Care project realizes that in Western countries, acceptable quality of life for the ostomate is there because there is a stomach care nurse available and there is a product available. But in developing countries of Asia, South America and Africa, this is not available. So as in Eastern Europe also, these things are not available. They have not acceptable life. This is how we can train nurses, other nurses in workshops. This is Professor Carlo Pescola, who came to do a workshop in North Karnataka, in Dharwad and Hubli and Belgaum. This was in 2006. Dr. Ashok Mehta, the Lions International President, then gave us US $10,000 as a grant to do projects in India. But the funds was not enough, and therefore the project did not have very effective uh, conclusion. Therefore, International Ostomy Association thought of doing a stomach care training program in India with the help of Access to Healthcare, which is basically a donation program of Coloplast, a manufacturing company of the, the ostomy products. And with the help of generous help of them, we have uh, provided Indian Stoma Care Nursing Education Program, which is basically an e-module learning program. This is a project of the International Ostomy Association. It has been generously funded by Access to Healthcare. It has been recognized and endorsed by the World Council of Enterostomal Therapy, and it is supported by Association of ETs in India, and it is helped by Lions of Bombay. This is a 3-year project, 70 hours of theoretical study and 70 hours of practical training. Theoretical study, they will do it on e-modules, and they can do it at home. There is no charge for that. But for practical training, they will have to pay partly to the hospital where they work. We will train about 1400 graduates through this program over the next three-year period. As I said, that the theory part is free. For practical training, we have identified the stoma clinics in different hospitals in India, and they will be trained there by a specialized trained nurse. The students will pay only part of it. Rest of it will be paid by the funds which has come from Access to Healthcare. The advantage of e-learning is they don't have to come to Bombay to stay for 3 months, and they will be able to study at their leisure, at their convenience, in their own hometown or in the hospital. We have just talked about that we will have many nurses being trained. And in 3 years' time, we think that we will train 1400 graduates. This is our core committee, where myself, Dr. Jagannath, Dr. Vijay Kumar from Bangalore, Dr. Vijay Arora, Anjali Patwardhan, Lion, Dr. Ashok Mehta, Dr. Bharat Pathak, and we have admin secretary and we have a logistic person. This is our education committee who helped me to form the education material for this program, especially on e-learning modules. If we can light one lamp, through that lamp we can light many lamps and help many patients across India. Friends, this is a very, very important project for India. This has never been done in India at all, this scale, and this will benefit many, many cancer patients who end up with a stoma in their life. Thank you very much.